Hi, my name's Akina and I just thought I'd do a quick video about what I'm studying at the moment. So basically I had a meeting with my supervisor and we went over my poster for brief psychological interventions, and basically the key things that were pointed out to me was that picking a patient with capacity, making sure they consent. So basically I'm doing a module on applying a brief intervention with a patient and presenting my findings and the outcome of using that intervention with that particular patient. And due to the fact I have to present it to a classroom of people, I have to ask the patient for consent. So before this I have to ensure the patient has capacity, and so far what I've done is I've put an imaginary patient together, just made it all up, and made a plan of what assessment tools I'm going to use. I'm going to use the recovery stack that allows me to establish what the patient's goals are. It also covers 10 aspects of the patient's life. I'm also going to use the Horgan Attitudes Inventory, which is all to do with medication for mental health, and this will help me gather the patient's views on taking medication. Also, what I'm also going to assess is the person's motivation, insight, and their understanding of the intervention. Yeah, so I feel like it's quite a lot of work, to be fair. It's all about having structured one-to-ones with the patient, so setting an agenda and spending time with that patient. So what my goal is next time is to approach the patient with some information, some psychoeducation, so let them know a bit about the stress vulnerability model, because this allows people to identify what causes them stress and how they can also resolve it, and then do the recovery start with them, find out their goals, and then pick what assessments will be suitable for that patient. After this is done, I will present it to my lecturer and see what she says. But yeah, sometimes it is difficult, like picking the right patient, so I think I'm going to have to speak to my colleagues, as they know where I work and the patients I work with, so that'll be quite helpful. Also, in regards to my mentorship course, there's a few fabulous students on my ward working at the moment, so I've spoken to one of the social workers I work with, and he is allowing me to teach the students a bit about the mental health factor, which is great. So those hours will add up to the 75 that I need to do for my mentorship course. It is difficult juggling 2 courses and working a full-time job, but I am enjoying it. And as to my driving lessons, they're going well, but I think I'm going to take a bit more time to pass my test than expected. It was quite difficult for me to accept this at first because I just wanted to get it over and done with. But now I'm just sort of taking my time with it and just allowing myself to learn and not putting pressure on myself, because I literally really do hate taking a long time to learn new things. So yeah, that's an update at the moment of what I'm doing in terms of my course and learning how to drive and my other course and nursing as a whole. I think it is really important, as a nurse, to make sure you do progress and not just work full time. I think it's really sort of motivated me to put my all into my job and gain some sort of satisfaction and gain something from being in my role. Yeah. So yeah, thank you for watching.